There are many types of alternative therapies that are supposedly beneficial to your skin or your health. The latest trend is Moxibustion Therapy, a form of heat therapy in which Moxa, a dried and pulverized version of the plant Mugwort, is burned very close to the surface of the skin. In general, Moxibustion doesn't get as much press coverage as acupuncture or some Chinese herbal treatments, but this soothing technique has a wealth of health benefits, especially as an adjunct to regular acupuncture sessions. In this video, we're gonna discuss superb relaxation with Moxibustion Therapy. The video is gonna be amazing, so make sure you stick to the end. Moxibustion is a traditional medical technique with Chinese roots. It uses natural heat therapy derived from dried mugwort plant that produces moxa when it's burned near the skin surface. The warmth is said to help dispel unwanted pathogens in the body, different from modern Western medicine treatments, which are typically formulated as one-to-one solutions for ailments. TCM therapeutic techniques, including Moxibustion, work on whole-body systems. As a result, they can play a role in helping a variety of concerns, offering a wide-ranging benefits that mostly depend on the person receiving them. Because acupuncture is a key component to a Moxibustion treatment, today, it's worth noting that folks might turn to Moxibustion for any of the proven upsides of acupuncture, including its potential to minimize chronic pain based on a 2017 analysis of 39 trials on non-specific musculoskeletal pain, osteoarthritis, chronic headache, and shoulder pain, as well as reduce pain linked to menstrual periods and improve sleep quality. Your Moxibustion therapist can apply the technique directly or indirectly. When used directly, the Moxa cone rests on the side of treatment on your body. The practitioner ignites one end of the cone and leaves it to burn slowly. Once your skin starts to turn red and you begin to feel the heat, the therapist removes the cone. In other cases, the practitioner places the Moxa on the acupuncture needle and ignites it. The Moxa will burn on the needle until it's extinguished. The heat is transferred to the acupuncture point through the needle. In the US, practitioners often use indirect Moxibustion, which is generally carried out in one of two different ways. In the first, the practitioner will hold the smoking end of a Moxa stick very close to the skin until the acupoint adequately warms. This signifies that blood and other vital fluids have been directed along the correct meridians and can begin to heal the patient's ailments. Many modern clinics use slower burning, smokeless Moxa sticks, which may be a comfort if you're concerned that smoke inhalation. Indirect Moxibustion may also be performed with a tiger warmer or using something as a buffer between the stick and the skin, such as salt, aconite, and slices of ginger or garlic. This warms the body deeply. Another indirect method is to wrap smaller balls of Moxa around acupuncture needles and light them until smoking. The heat is driven down the needle shaft and into the acupuncture point, enhancing the effects of the needling. Usually a ball of Moxa wool will be placed on just one or two of the needles in each session. Many patients report a warm, soothing sensation during and even after a session of Moxibustion. Moxibustion can relieve pain and provide relaxation without medications or surgery. While some may find it simply uncomfortable, other patients, especially those with existing respiratory problems, may find it more bothersome. Fortunately, there are smokeless Moxa sticks available these days that can be used as an alternative when treating patients who are sensitive to smoke and strong odors. Although still quite effective, many still prefer what is called the true Moxa made from mugwort, which unfortunately produces a lot of smoke because it's believed to be more effective. Moxibustion is easily combined with all forms of acupuncture and can be an important adjunct to a variety of treatments in complementary medicine. In traditional Chinese medicine, it's considered equal in healing power to diet, exercise, meditation, and cupping. When properly administered by an experienced and certified practitioner, Moxibustion therapy is safe. During an in-depth consultation at Dr. Mosher's office, he can carefully determine if Moxibustion is right for you. Practitioners often do both acupuncture and Moxibustion in the same clinic session when appropriate to the diagnosis and treatment strategy. Many modern clinics use slower burning, smokeless Moxa sticks, which may be a comfort if you're concerned that smoke inhalation. Indirect Moxibustion may also be performed with a tiger warmer or using something as a buffer between the stick and the skin, such as salt, aconite, and slices of ginger or garlic. This warms the body deeply. Another indirect method is to wrap smaller balls of Moxa around acupuncture needles and light them until smoking. Practitioners believe that therapies increase each other's effectiveness when used together. Unlike acupuncture, which is almost always done by a trained practitioner in a clinic setting, Moxibustion can be easily used at home. It's not uncommon for Chinese medical practitioners to train their patients to use Moxa on themselves to strengthen the effect of the clinical sessions between appointments. Moxibustion treatment is simple, easy to perform, and cost-effective. This modality is also more easily applicable than acupuncture, which is subject to variation caused by the different needling techniques of individual practitioners. In one study, scientists used indirect Moxibustion over 2 acupoints in 42 people with Hashimoto's thyroiditis autoimmune hypothyroidism. They found that the group that underwent Moxa treatments, in addition to taking prescription drugs, had better thyroid function than the group that only took the drugs. One of the Moxibustion's most intriguing applications for women is its potential to turn breech babies, those that are upside down at term. About 90% of breech babies must be born via cesarean section, but most women would prefer to avoid this. Recent studies have shown that Moxibustion, when combined with partial techniques and/or acupuncture, can turn babies over so that they're in a less dangerous position at birth. This may be because of Moxibustion's ability to stimulate uterine contractions that can gently turn breech babies around. Combining Moxa with acupuncture works synergistically, says Sian James, DACM LAC lead acupuncturist at Aura, a New York-based acupuncture studio. The acupuncture and Moxa together can further promote the physiological response of increased circulation, and in turn, that improved blood flow can both decrease inflammation and boost your range of motion and flexibility, which can help with chronic muscle and joint pain, adds Dr. James. Research backs her up. A 2017 review of studies analyzing the efficacy of Moxibustion for osteoarthritis in the knees suggests it can help with both pain reduction and symptom management, while a separate 2020 review found that Moxibustion may help relieve the nerve root compression and swelling commonly linked to chronic low back pain. Similarly, the circulation-boosting effect of Moxibustion can offer some pain relief benefits to period havers. Moxa works to drive blood flow to the uterus, which can help calm severe menstrual cramps, says acupuncturist and herbalist Giselle Wasfi, DACM LAC founder of Remix Lifestyle. A Chicago-based acupuncture studio and a small 2015 study of Moxibustion's efficacy for treating cramps in 56 nursing students demonstrated this pain-reducing effect too. Burning Moxa also has an exterior benefit through its scent, which is slightly sweet and herbal and can be very soothing to the spirit, naturally opening the heart, adds Dr. Wasfi. While the use of Moxa is proven safe to use by years and years of Chinese medicine, it's not advisable for everyone and should only be used for its known purposes. Other possible complications are respiratory issues arising from the inhalation of Moxa smoke. The plant is known to produce a huge amount of smoke and also cause a strong pungent odor. While some may find it simply uncomfortable, other patients, especially those with existing respiratory problems, may find it more bothersome. Fortunately, there are smokeless Moxa sticks available these days that can be used as an alternative when treating patients who are sensitive to smoke and strong odors. Although still quite effective, many still prefer what is called the true Moxa made from Mugwort, which unfortunately produces a lot of smoke because it's believed to be more effective. Many clinics simply combat the smoke and odor with the use of in-house air purification systems. Several studies have been conducted in trying to establish how Moxibustion therapy benefits your health. They also strive to find out the safety and effectiveness of the procedure in treating various health conditions. One study has found Moxibustion to be excellent therapy for chronic kidney disease. Researchers found it to have a great effect on reducing serum creatinine, which is responsible for poor kidney function in high doses. A study involving 51 women in their postmenopausal stages tried to establish the effect of Moxibustion on hot flashes. The researchers found that undergoing 14 sessions of therapy helped reduce the severity and frequency of hot flashes. The existing scientific evidence on the use of Moxibustion to treat inflammation of the bowel is not conclusive. The studies determined that the technique doesn't provide any benefits for people with ulcerative colitis. However, these studies were of low quality. However, studies are ongoing to establish the safety and efficacy of Moxa heat in the treatment of inflammatory bowel disease. Moxibustion is considered a safe alternative to help with breech presentation. This refers to a condition where the baby is positioned with its feet first in the birth canal. This position makes for a difficult delivery. A 2005 study could not establish that Moxibustion is effective in helping the condition. They concluded that further research is necessary before recommending Moxibustion to women looking for a solution to breech birth. However, the report showed that Moxibustion can significantly reduce the need for medical procedures used to correct the presentation. For the best outcome, it's recommended to have the procedure carried out by professionals. Some hospitals have midwives and obstetricians trained in Moxibustion and acupuncture. Acupuncture practitioners must also be licensed in this case. Like with many traditional Chinese treatments, consistent, sustained application is key. Let us know your opinion in the comment section below. This was all for today. Hope you liked the video. Don't forget to subscribe to our YouTube channel. Please click on the next video clip to watch for more health info. Thank you very much.